Is it okay if I come in?
Yes.
Hi, ShariLD. I'm Kashari Davis. I'm going to be your nurse practitioner today, and I'm coming to do your annual exam and a complete health history. Is it okay if I examine you and record it for my professor to see?
Yes.
Okay. You're ShariLD Alexander. You're Lumbee Native American, and your birthday is February 4th, 2000, and you'll be 19 years old in February. That's correct? Okay. Your weight is 122 and your height is 5'2".
Yes.
Okay, so your BMI is pretty good. And BMI is body mass index, and that just compares your weight to your height and says you're in a healthy range. You're not overweight or obese or anything like that. So your diet is pretty good, and that's great for you. Does your family have any history of illnesses, like your mother, your father, aunts, uncles, paternal grandparents, or maternal grandparents?
My mother has hay fever. My father has high blood pressure. My maternal grandmother has diabetes. My paternal grandfather has strokes and high blood pressure. And my paternal grandfather has high blood pressure, and my paternal grandmother has high blood pressure.
Okay. Do you have any known drug allergies or allergies in general?
I have hay fever and I'm allergic to grass.
Okay, so you have hay fever and you're allergic to grass. Are you currently taking any medications right now?
Amoxicillin.
Okay, so you're on amoxicillin. And do you know the dosage of your amoxicillin? How many pills do you take daily?
2 pills a day.
2 pills a day. Do you know like the dosage is 875 milligrams or
500.
500 milligrams? And you take 2 of those a day. What are you taking the amoxicillin for? Do you know? Do you know what doctor prescribed that? It looks here, I can look in our system. I think you saw a specialist. I'm not sure who referred you to that specialist, but it looked like Dr. McGrath, if I'm not mistaken, prescribed that. Were you having any skin issues that we need to know about? That's what they usually prescribe amoxicillin for. Any rashes or anything?
I had a rash on my back. Okay.
So that's probably why. Has it cleared up since you've been taking the amoxicillin? Okay. And your vital signs, they look pretty good. Your heart rate was 80. Your blood pressure was 117/74, which is great for your age. Your respirations were 16 respirators per minute. And your O2 stat was 100 on room air. So that's great. That's excellent for your age. And now I'm just going to do an assessment. And I'm going to use a pen light, and I'm going to look into your eyes just to make sure everything is normal, like your pupils are equal and reactive to light. And I'm going to look in your throat to make sure there's no redness, swelling. Your tonsils look normal, no abnormalities there. I'm going to listen to your heart and lung sounds just to make sure they sound normal, and check your pulses, and I'll inspect your stomach, which we also call your abdomen. You already told me about your skin issues, and your skin looks really beautiful, by the way, so hopefully everything will stay okay. And I'll look at your back just to make sure that everything cleared up with that amoxicillin. You don't have any psychiatric history or anything in your family, right? Okay. Any musculoskeletal issues that you're concerned about? And that's like with your muscles or your bones. Okay. And then I'll check your neuro. I'll probably just ask you to smile. Make sure your smile is even. No, you did say one of your family members had a history of stroke, but you your blood pressure and everything's fine, so you won't have to really worry about that until you're older. And then I'll check your labs. We'll draw labs for your annual visit and check like your thyroid gland to make sure that's working normally for your age. No blood problems in the family that we need to know about. No anemia or anything like that, okay? Alright, so I'm going to go ahead and wash my hands. And let me get my pen, like I'll put this down for a second. So your pupils are normal, which is great. I'm gonna just feel your throat just to make sure you don't have any swollen lymph nodes. I'm gonna look in your ears. Your braids are nice.
Thanks.
Alright, your ears look great. They're clean and everything, so that's good. Any problems with your nose at all? Let me look in your throat. Say "ah" for me. And stick your tongue out for me. Your tonsils look great, normal size. All right, now I'm going to listen to your heart and lung sounds. Take a deep breath for me, and then exhale. I'm going to listen to your stomach and make sure you have bowel sounds. You must be pretty hungry. I hear a little bit of growling going on in there. All right, I'm going to have you lean forward and I'm going to listen to your lungs. Your breath sounds. Can you take a deep breath for me? And exhale. A deep breath, exhale. All right, everything sounds pretty great. Pretty good. I'm gonna feel your pulses. Can you grab my fingers and squeeze them as hard as you can? That's the neural assessment to make sure your musculoskeletal and everything, and your neuro is working all right. Can you smile for me? All right. And then follow my finger. All right. So everything looks good. And you haven't been having any issues with your feet or your legs or anything? Okay, that's great. And we're going to run a few tests, lab tests, to check your cholesterol, complete blood count, and basic metabolic panel. Since you said that a lot of people in your family had high blood pressure and some had, I think you said somebody had diabetes, your grandmother. We'll just check your cholesterol. That's something we do with annual visits here, just to make sure that your cholesterol levels are okay. The complete blood count looks at like your white blood cells, your red blood cells, and things like that to make sure everything's in the normal range. Hopefully everything is good with that. If something comes back abnormal, we will call you and let you know what came back abnormal and why it might have and what the next steps are. The metabolic panel, that just looks at like your potassium, which is your electrolyte levels. And we'll go ahead and check a hemoglobin A1C to make sure that you're not at risk right now for diabetes, since you did say your grandmother has diabetes. And that hemoglobin A1C, the normal value for that is 4% to 5.6%. That's the range. If it comes back elevated, like 5.7% to 6.4%, then you could be at risk for diabetes, since it does run in your family. But fingers crossed, everything will come back normal for you. Did you have any questions about anything today, or when your lab results or anything will come back? Okay, so I'll just tell you, they'll be back in about 2 weeks. And if anything, like I said, comes back abnormal, we will give you a call and let you know. And if you have any concerns in between that time, just call back and schedule an appointment. Like if you have a specific problem or anything, or notice some symptoms, or discomfort or anything that is out of the norm for you, just call back and make an appointment and I'll be happy to see you, okay? You sure you don't have any questions? Anything I said that didn't make sense? Okay. All right, well, it was nice meeting you, Serenity. And I hope to see you again soon. And I'll call you if anything's abnormal. And I also will mail you the results. So if you don't get a call from me, everything was normal. And you'll get the results regardless, because I'll send them to you in the mail and they'll have the normal ranges on the sheet that you get in the mail, okay? All right. Have a good day.